So in this video we will demonstrate the planning of reverse radial artery forearm flap for a dorsum of hand defect. So this is a defect which we have marked on dorsum of the hand, and now we will begin with the planning. So as for all flaps, the first important thing is mark the important landmarks. In this case it is the course of the radial artery. So we palpate the radial artery distal point near the radial styloid, mark that point, mark the midpoint of the cubital fossa, and the line joining these 2 points is the course of the radial artery. So the next point is marking of the pivot point. So pivot point is marked approximately 4 cm proximal to the wrist crease. So we can shift it nearer to the wrist crease depending upon the requirement of our defects. So once we have marked the pivot point, next